I used to marvel all these surgeons. I wanted to be a surgeon myself. But then, my mind changed when I went to the districts and just saw the gravity of the problems there. Before I went for my PhD, I was a district health officer in Malawi. And that is the time that I really appreciated the sort of problems that we had. I was a doctor then. I was treating one patient one after another. And to see the number of children that were sick or dying with malaria, the impact of TB and HIV. But I saw that, maybe to have a greater impact is to do research and identify tools that would fight these diseases. I was trained in America. There are tons and tons and tons of researchers there, mostly working on diseases that are not that relevant to Malawi. Because as one of the Malawians at that time returning from PhD studies, and there were not a lot of Malawian researchers at that time, basically there was nobody really at a senior level. We came up with this idea of establishing a research support center to support junior scientists, but also to create a conducive environment for experienced scientists who might have been outside Malawi to operate. So the key functions that we put in the research support center was like grants management. Because at that time, if you had a research grant, you were the accountant, you were the procurement officer, you were doing everything as a senior research scientist, which is not a great use of your time as a scientist. So I think that that's the biggest achievement of the RIC, in that grants management has improved quite a lot. But also it delivers short-term training, like on GCP, good clinical practice, and clinical trial management. These are important courses delivered to young scientists or junior staff working in projects so that they perform according to international standards. So in a nutshell, it builds the confidence for the research funders. At the moment, it's looking good because there are big ongoing projects run by Malawian scientists, but also there are our collaborators who are running big grants, and they're passing those grants through the College of Medicine Research Support Center. And every grant attracts an overhead fee that is able to be channeled back to strengthen the research support center and support the staff that are working there. And I think when people see local Malawians publishing, getting good grants, having a career, being happy at home, and continuing to produce good research work, we are seen as role models. During my years, I used to marvel all these surgeons. I wanted to be a surgeon myself, and everybody aspired to be like them. But now the field is wider. People look at those surgeons out there, but also they look at scientists out there. When I was coming back, the only role models they could see were people from outside Malawi. Honestly, in my experience, I've seen a larger percentage of medical and pharmacy students getting excited to read a research career even before they graduate. Working with the Dutch scientists has been great. The Dutch scientists have now recognized the kind of problems that we encounter here in Malawi, but also we have taken advantage of the technology available in the University of Amsterdam to accomplish our research studies. So that collaboration has been great. Basically, the success of the Research Support Center will also depend on continuous support from experienced research institutions. Yes, I think the Research Support Center has been very successful, and its success has been presented outside Malawi, and basically people like the model. So recently, the Wellcome Trust actually funded the College of Medicine to strengthen its research capacity, but also several African countries, Southern African countries, to have a model similar to the Research Support Center. So with that funding, basically a new Research Support Center has been established in Zambia, at University of Zambia School of Medicine, and at the University of Zimbabwe. one of the dangers could be complacency, to think that we are there. We have achieved everything that we have achieved. Because I think that what we have done now is just a start.